Bismillah ar-Rahman ar-Rahim. Make diabetes remission a reality. This is advice of Diabetes UK, and we'll make it our take-home message. A few years ago, when the subject of diabetes remission was raised, a lot of physicians thought that it is not practical, not achievable. But nowadays, and I hope after this short story, we will be convinced that it is practical and achievable in a very large percentage of type 2 diabetics. The first mention about this diabetes reversal or remission was in the global report of diabetes by the WHO in 2016. Very low calorie diet can lead to the reduction of symptoms or to the reversal of hyperglycemia typical of type 2 diabetes. The reversal may be maintained so long as weight is not gained. Then, if you open the Diabetes UK website, you will find diabetes remission a very important item with a lot of explanation and data. And this subject, diabetes remission, is not only a subject to be discussed in the association of this kind of thing, but in June 2022, this is an update for practitioners. So it is now considered to be something that should be done by practitioners. Again, this is another paper here. The title said, Remission of type 2 diabetes is a position statement from Association of British Clinical Diabetologists and the Primary Care Diabetes Society. So the clinical diabetologist and primary care now are interested in diabetes remission. To specify what is meant by diabetes remission, it is the absence of symptoms of diabetes and hemoglobin A1C below 6.5% for 6 months without any diabetes medications. What is the logic beyond diabetes remission? In this graph, we find that between the year of 1997 and 2015, this is a 18 years period, the diabetes incidence and was increased by 3-fold, and this is very alarming. Again, if we look into the studies of the control of diabetes, we will find that the control is lost along the course of diabetes, because they said that it is a progressive disease. Again, here all the different types of drugs are used, and again the control is lost because they said again it is a progressive disease. Even in the advanced countries, diabetes is not well controlled. 2/3 of type 2 diabetics are not controlled. So there seems to be something wrong. Then they said that you will intensify the glycemic control. When they intensify the glycemic control, they get good results as regards micro and microvascular complications. But regarding the macrovascular complications, there was no appreciated effect or positive effect. And regarding the mortality increased in ACORD study. As we know, it was terminated prematurely because of the increased mortality. Again, if we look into this graph that illustrates the incidence of diabetes cases in 2 cities in Netherlands, we will find that the number of cases dropped very sharply, almost zero in 1944, where the World War II, because of the World War II. So if there is no ample amount of food, there is no diabetes. So now diabetes is not well controlled and is tightly related to diet. Again, this observation with the bariatric surgery or metabolic surgery, the remission of type 2 diabetes was observed in more than 95% of cases in one of the modalities. So it is not a chronic progressive disease. It can be reversed, and this is a proof of this. This is why Diabetes UK starts to start a direct study, diabetes remission clinical trial. This is a study funded by Diabetes UK and sponsored by a National Health Service. So there is no bias, there is no interference by the pharmaceutical companies. So it is a non-biased study. The results of 2 months of the study depends on low-calorie diet controlled by the investigators. The 9 out of 10 participants who lost 15 kilograms or more were in remission. 9 out of 10. After 2 years, 2/3 of those who lost 10 kilograms or more were in remission after 2 years. What is the biology of remission? The biology of remission. The chances of remission were closely linked to weight loss. Nearly 9 in 10 people were in remission if they lost 15 kilograms or more. This significant weight loss resulted in a drop in fat in both the liver and pancreas. And as we said before, the drop in the fat of the liver improves the insulin resistance, and the drop of the fat in the pancreas improved the beta cell function. As you can see, the liver fat was 36 before the enrollment in the study and became 2%, dropped from 36 to 2% by the loss of 15 kilograms of weight. Also, fat removal from the pancreas can restore beta cell function, as this study denotes. Now, we believe that diabetes remission is not achievable in all cases, but if we aim at losing weight, we will get other benefit rather than diabetes remission, which is improvement in general activity, less medication, less chance of complication. And we can lose weight by any mean, or by all means, by healthy diet, exercise, bariatric surgery if needed, and drugs. So we should, in the future, make diabetes remission is the aim when we prescribe diabetes drugs, to control and aim at remission. If we follow what we have said, we will get rid of this very bad sequelae of diabetes with its complications, this kind of thing. Why is remission important? It increases our knowledge regarding the pathophysiology of diabetes. What was so as a lifelong progressive condition does not have to be like this anymore. The possibility of achieving remission provides hope and motivation. Remission can be life-changing for those who achieve it. The opportunity to stop taking diabetes medication, the need to manage diabetes day-to-day basis. Lowering hemoglobin A1C can result in reduction in the risk of challenging diabetes complication or potential cost saving by this method. We will touch the why some patients get rid of diabetes or go into remission and other not. Because type 2 is not just one type or one entity, it has different modalities or different types: severe insulin deficient diabetes, severe insulin resistant diabetes, mild obesity related diabetes, mild age-related diabetes. And I wonder whether this classification, which is based on hemoglobin A1C, HOMA-B, HOMA-IR, body mass index, and age, can be correlated with the study of the genotype or genome study Dr. Hanan talked with us about. May be correlated or not, I wonder. Last but not least, this is a study. It's called It was conducted from January 2018 to August 2022. As Professor Adel said, the results will be available after 2 months or so. It is called RETUNE study. It is reversal of type 2 diabetes upon normalization of energy intake in non-obese people. Non-obese. That study was done on obese subjects, but this in non-obese. So diabetes remission can be achieved in obese and non-obese. This study aimed at proving that or not. The budget of this study is more than £500,000 sterling pounds. This more than 10 million Egyptian pounds. So this shows how important this topic is. Now I will discuss maybe a new concept or something like that. That in the past we were concentrating in the level of glucose, the serum glucose. But I think if we concentrate in the body glucose, we'll get better results. I'll show you why. How to decrease the body glucose? Through less in, more out. Less in through healthy diet and acarbose and bariatric surgery. More out through exercise and SGLT inhibitors, 2 inhibitors. What increases body glucose or body lipids? Consequently, unhealthy diet, pharmaceutical secretagogues, increase insulin secretion, and if we use insulin, both this condition increase body serum insulin that cause more glucose into the cell, whether we will burn it by exercise, this kind of thing, or the remaining amount will be stored as glycogen or lipogenesis, which is a hallmark of the diseases of, as we said, of the insulin resistance in the liver, beta cell dysfunction in the pancreas, and atherosclerosis and coronary heart disease in the vascular system. So if we draw a line between the right and the left side, all these interference modalities improve in the cardiovascular disease complications, the other no improvement, so that we should concentrate in to decrease the body glucose and body lipids rather than the serum glucose or serum lipids. So, shall we make remission a reality? Hopefully. Christian Bernard, the famous cardiosurgeon, said, "I have saved the lives of 150 people with heart transplantation. If I had focused on preventive medicine earlier, I would have saved 150 millions." And thank you. This slide, the recording of the lecture can be reached through scanning this QR code. Thank you.